The most common significant injury in Malaysian badminton players is not the ankle sprain most people expect, it is the shoulder. Specifically, it is progressive rotator cuff damage from the repetitive overhead mechanics badminton demands. And unlike an ankle sprain, rotator cuff damage announces itself late after substantial tissue destruction has already silently occurred. The mechanism is straightforward once you understand the anatomy. The rotator cuff comprises 4 muscles: supraspinatus, infraspinatus, teres minor, and subscapularis. Their collective function is to compress and center the humeral head in the shoulder socket during arm movements, particularly overhead ones, providing the stabilizing counterforce that allows the larger prime movers to generate power without the joint mechanics collapsing. During a badminton smash, the shoulder generates high rotational velocity through the full overhead range, and in a well-conditioned shoulder, the rotator cuff maintains the joint mechanics throughout, session after session, year after year. In an unconditioned shoulder, which describes the majority of recreational players who have never done any targeted shoulder conditioning, the rotator cuff fatigues before the session ends. Once it fatigues, the large prime movers, deltoid, pectoralis major, latissimus dorsi, continue generating overhead force without the stabilizing counterforce. The humeral head migrates superiorly with each swing, and the supraspinatus tendon and subacromial bursa repeatedly impinge against the coracoacromial arch above them. Each impingement episode causes microtrauma. In the early stages, this produces only mild post-session shoulder ache that most players dismiss as normal training soreness. The cumulative tendon damage continues invisibly across hundreds of sessions until the tendon is partially or fully torn, at which point surgery and 6 to 12 months of intensive rehabilitation are often required, and some players never return to their previous shoulder function. The prevention protocol takes 8 minutes, 3 times per week, and requires only a resistance band. Resistance band external rotation. Anchor the band at elbow height. Keep your elbow bent 90 degrees and tucked to your side throughout. Rotate your forearm away from your body to the full available range for 15 slow repetitions each side, holding 2 seconds at end range. This directly conditions the infraspinatus and teres minor, the external rotators most commonly insufficient in overhead athletes. Prone YTW, lying face down on a mat, lift your arms into a Y shape overhead and hold 2 seconds, lower, then into a T shape horizontally and hold 2 seconds, lower, then into a W with elbows bent and hold 2 seconds, lower, 10 repetitions of each letter. This builds the scapular stabilizers that control the platform from which the rotator cuff operates, preventing the scapular dyskinesis that compounds impingement risk. Scapular wall slides, back against a wall, arms in a cactus position with elbows bent at 90 degrees. Slide both arms upward while maintaining full contact between your arms and the wall. 10 repetitions, slow and deliberate. Players who perform this program 3 times per week throughout their badminton season show dramatically lower shoulder complaint rates than those who do not. If you already have shoulder pain during or after smashing, stop performing overhead power shots and get a physiotherapy assessment before continuing full training. The earlier a rotator cuff problem is identified, the shorter and less invasive the treatment required. Grade 1 and 2 rotator cuff involvement treated at the first signs of consistent post-session shoulder ache typically resolves in 6 to 10 sessions of physiotherapy. A partial tear identified after 6 months of continued play through the pain requires a significantly longer and more complex rehabilitation, and a full thickness tear may require surgical repair first. The window between early intervention and late intervention is measured in months, not years. Beyond the shoulder, single leg balance training for ankle proprioception, 30 seconds each leg, 3 times per week, is the highest value ankle sprain prevention strategy available. Proprioceptive training takes less than 2 minutes and directly reduces the neurological gap between ankle inversion stress and the muscle response that prevents the ligament from being loaded beyond its tolerance. Court players who include this in their warm-up routine consistently show lower ankle sprain rates across a season than those who do not. The complete badminton injury guide with the full conditioning program is in the link in the description.